Hi, I'm Tammy Peterman, President of the Kansas City Division of our health system. Thank you for joining us today. This is Health System Week, a special time always for us to recognize our staff and physicians for the remarkable work that happens every day in our health system. And we'll always do that. And in addition, this week is a little different. As we all know, this has been a year unlike any other as a result of the pandemic. That's why we added this special ceremony. We wanted an opportunity to reflect on the challenges of the past 15 months, to remember the patients that have been cared for, and to acknowledge our team's resilience and courage and strength, and to reflect on how the pandemic has impacted all of our lives. And while COVID-19 is still with us, we're also focusing on healing as we move forward together. So much has changed over the last 15 months. In March of 2020, we were admitting the first COVID-19 patient in the region. We knew things were going to change quickly, and they did, at work and at home. As we made adjustments in our personal lives, we all pivoted to new ways of caring for our patients and new ways of working, no matter our role. Our employees and our physicians stepped forward to help in any way they could. Truly amazing. You and your teams did remarkable things with incredibly short timelines, from expanding our lab capabilities to standing up a drive-through testing process, to implementing telemedicine, to adding a new area in the emergency department, and so many others. These are just a few examples. We're also grateful for the community's support. It was been pretty remarkable as well, from the meals from the local restaurants to the PPE that was donated by friends and neighbors. So many people in the community have supported us and continue to do so. We've always been confident in the ability of our teams to take care of our patients because of the knowledge, the capabilities, the expertise, and the compassion. Today, we're hopeful that the pandemic might soon be behind us. But while we're optimistic about the future, we need to reflect on this time none of us will ever forget. In the next few minutes, you're going to hear from members of our team who will share some stories about how the pandemic has impacted them. Before we begin, I want to say thank you to our guitarist, Larry Beekman, who's providing beautiful music for this event. And now I'd like to introduce to you Dr. Chris Brown from Internal Medicine and Sarah Banner from Respiratory Therapy, who will be sharing the first reading.
Good morning. Our first reading today is We Remember by the Reverend Dr. Kendall Gibbons. When death comes suddenly, taking just one, or in a magnitude beyond our comprehension.
In horror and disbelief, we remember.
When bright and innocent lives are cut short without warning or mercy.
In agony and outrage, we remember.
When another long life ends in isolation and separated from loved ones.
In bewilderment and heartache, we remember.
When bereavement and loss seem to be everywhere we turn and the world goes dark.
In emptiness and pain, we remember.
When help and comfort must be given to the sick and suffering, and the work of our hands is needed.
In duty and sacrifice, we remember.
When it feels that nothing matters, and life as it once was seems distant and unreal.
In sorrow and numbness, we remember.
When grief comes upon us in waves, and the helpless heart overflows.
In sadness and aching tears, we remember.
When words at last become meaningless and we turn inward, seeking peace and comfort.
In silence and solitude, we remember.
When communities come together and work and the hurt are shared.
In mutual comfort and consolation, we remember.
When the Spirit of life beckons us to lift our eyes to all that remains true and good.
In dedication and trust, we remember.
When the lessons of mutual help and understanding taught by tragedy live on in us to bless the world.
In compassion and solidarity, we remember.
When we come to honor all we have lost by learning to cherish more deeply all we hold dear.
In generosity and gratitude, we remember. Did you not have the last one?
Hi, my name is Casey Pickering. I'm the nurse manager of the Medical ICU, program manager for our Rapid Response Code Blue program. And additionally, over the course of the past year, I've had the opportunity to, on several occasions, open an alternative bed ICU area in order to accommodate our COVID-19 patients in that census. So when I was first asked to speak here today, I thought, how can I possibly summarize and accurately reflect this experience in a short period of time about what it's like to be on the front line? And I started thinking that people ask me all the time, what do you wish you had known when the pandemic started? And I think that it's in answering that very question that I can give a little bit of insight as to what it was like for folks on the front line across our health system. So with that, this is not an all-inclusive list of what I wish I would have known. I wish I would have known that on March 7th of 2020, with the admission of our very first COVID-positive patient, as a health system, it was the start of a journey that would inevitably challenge and change us all forever. And 11 days later, when we had to tell every individual visitor they would have to leave only to not return, that it was just the beginning of the gut-wrenching conversations that we would have about visitation, conversations that continue today. And no, they haven't gotten any easier. I wish I would have known that family members and friends would beg and plead for us to not let their loved ones die alone, and we would go to extreme measures to keep each and every one of those promises. That these patients would be afraid, but in a much different way than we had experienced before. That many of them, while hospitalized, were simultaneously watching their fate play out on TV, and it seemed like a scene straight out of a movie. That for many, we would be the last person to hear their voice, and our voices would be the last they heard. And all too similarly, our hands would be the last that they would ever hold. I wish I had known that we would learn the hard way to stop promising patients that they were going to be okay, and we would start promising that we were going to take the very best care of them. That there would be countless sleepless nights due to vivid nightmares around resources, PPE, patients dying, and even our own staff contracting COVID and dying, leaving us without enough help to care for everyone. That our PPE, while it protected us, it would leave us bruised and battered, and sometimes even bloody, but it would in fact always protect us. I wish I had known that we'd often spend more time at the hospital than at home, and we would all take the phrase work family to an entirely new level, because for many of us, our peers were the only ones who could possibly understand what it was we were going through. That we would become the integral link between patients and families during their most difficult days, which would be challenging, exhausting, and also incredibly rewarding. I wish I had known that the decompensations would often come quickly, and despite our uncompromising efforts, many of these patients would not survive, leaving us feeling defeated and at times completely devastated. That for many patients to survive the discharge meant an incredibly long and hard journey. That hope is not a promise, and no one was ever out of the woods. That the losses would be frequent and incredibly heartbreaking, and we would have to cling to the success stories for days on end just to help carry us through. I wish I would have known that we would all navigate our own personal loss and grief while simultaneously navigating significant loss and grief every day at work, only exacerbating our emotional exhaustion. That the shifts would be harder and longer than anything we had ever experienced, and some weeks, every day felt like it was a bad day. That we would often leave wondering, how can we possibly come back and do it again? And yet we always would come back and do it again. I wish I had known that many patients would be alone, that virtual goodbyes would become the norm rather than the exception, and even those were never guaranteed. What I really wish I had known was that despite the challenges, the grief, the loss, the stress, we would redefine what it means to be resilient, and we would all gain a deeper understanding and appreciation of what it means to show grace. We would have to find creative and innovative ways to bring our hearts to this work, but we would continue to show up for our patients and families in meaningful ways, providing moments of joy in the most tragic situations. That there would be laughter and tears, joy and heartache, triumph and defeat. And with all that, there would be immense pride knowing that one day we will look back on this and we will know that we did our part and so much more. I wish I had known that while this pandemic would prove to be one of the greatest challenges of our time, we would all rise to this occasion, highlighting the importance of each and all of our roles, the strength of our teams, and profoundly showing that we are in fact so much better and stronger together.
Good morning. I'm Steve Steitz, Executive Vice President of Clinical Affairs and Chief Medical Officer here at the health system. Every one of us has been impacted by the pandemic, but especially those of you who have cared for COVID-19 patients, whether you're a nurse or a physician, a respiratory therapist, a member of our environmental services team, a transporter, a chaplain, or many other roles. You have seen COVID-19 in ways many of us can only imagine. There have been times of heartbreaking losses and incredible stress, but there have also been times of joy, especially when you knew a patient was going home. In the past year, we all learned how to stay safe. And those rules of infection prevention and control, those rules keep you safe, even into this moment and for every day long. We taught our community the pillars of infection prevention. We learned how to care for hospitalized patients and how to prevent hospitalizations in the first place. And we witnessed the development of vaccines at a miraculous pace. These life-saving vaccines were developed in a matter of months and not years. And while technology can never replace being together in person, we also learned how to use Teams to connect with our coworkers and telehealth to connect with our patients. We also used this technology in our personal lives as we celebrated birthdays, graduations, and even another run at the Super Bowl. It feels great to start to be back together in person. But we all know our COVID-19 journey is not over. But taking time to pause and reflect now is incredibly important for all of us. Behind me are flags of remembrance and healing, capturing your prayers, gratitudes, memories, intentions, and hopes. These flags are inspired by Native American and Buddhist spirituality. They were made to benefit both the person who created them and to benefit our community and beyond. Hundreds of you have submitted these flags. While we wish we had time to read them all today, we have invited representatives of our team to share the messages of their flags. Their messages will be followed by a moment of silence. I'd like to welcome Father Dominic Pham, chaplain, to read his flag, and Cara Perdum, one of our nurses here at the health system, and Dr. Dana Hawkinson, the medical director for infection prevention and control.
Lord, be with us today as we remember our patients, families, and staff who have died from the virus. Thank you to our staff for their care and sacrifices. Keep them safe and protect them always. May our institutions always be a sign of hope, comfort, compassion, and love to all. Amen.
At the beginning, we faced our fears and worked to overcome them. This will not break us. We continue to stay in the present and grind for our patients and their families. Today, we continue to bring strength, positivity, and hope to those affected by COVID-19.
We'd just like to say thank you to the health system executives, physicians, nurses, and support staff for always working to keep each other and our patients safe.
Hi, I'm Melanie Simpson, a call center nurse consultant with COVID operations. Our second reading this morning is We Hold Hope Close by Reverend Teresa Soto. In this community, we hold hope close. We don't always know what comes next, but that does not dissuade us. We don't always know just what to do, but that does not mean that we are lost in the wilderness. We rely on the certainty beneath, on our foundation of values, the strength of our courage, determination, and compassion. We return to the challenges of this time like a North Star, and to the truth that we are greater together than we are alone. Ours is not a wishful hope, living in some glimmer of indistinct future. Rather, we know the way to the healing of which we dream, and by the commitment and the movement forward of one right action and the next, we know that day of hope will arrive. Ours is a living, breathing hope that is alive with us right now. In this community, we hold hope close, as we also extend hope to all whose lives we've touched. Thank you.
I'm Bob Page, President and CEO of our health system. This past year has tested us in so many ways. It's tested our skills, it's tested our teamwork, and it's tested our resilience. And in fact, you could say it's tested our courage. Our health system has never been afraid of a challenge. In fact, our true north during every challenge we have faced has been to remain focused on our patients and our community. So it's no surprise to anybody how hard you worked together to ensure our patients could continue to receive the care they needed during this pandemic. Nothing, and I mean nothing, not even a pandemic, could stop you from being here for our patients and their families. You know, we've learned an awful lot during this past year. We've learned how nimble we can be as a health system. We've learned how remarkable our team is. And we've also learned a lot about ourselves. We all have a story about how the pandemic has impacted us. You've just heard some incredible and inspirational stories from our employees. And I know many of you also have your own stories full of challenges, achievements, and loss, but also hope for the future. As we all focus on getting back to some sense of normal and brighter days ahead, our executive team wants you to know we have not forgotten what you have been through and what you continue to experience every day. We see every day how you provide amazing care and how you always put our patients first. We also know you have done all of this while managing the impact of the pandemic on your own family and your own lives. This year has reminded us we truly have the best team in the country. We're proud of you. We're inspired by you. But most importantly, we are grateful for everything you do for our patients and their families each and every day. Thank you.
Boom, 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 boom. Boom 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 boom
when the night has come and the land is dark and the moon is the only light we'll see. No, I won't be afraid. No, I won't be afraid. Just as long as you stand by me, stand by me. So darling, darling, stand by me. Oh, stand by me. Oh, stand by me. Stand